And Catherine is going to hit record, I believe, as well, if she hasn't already. Perfect. Hi, everybody. Thanks for joining us for the Ask Me Live studio session. My name is Rebecca. I'm a student at Memorial University. I'm in my 4th year of a kinesiology degree, so hopefully I'll be graduating in April. I'm also a Memorial ambassador this year. And today we're chatting with Kelly Neville and Missy Power from the Student Wellness and Counseling Center. Before we get started, just a couple of housekeeping items. This session is being recorded, so if you're participating, you're consenting to that. Please ensure that your microphone and your video is turned off, except for myself and Missy and Kelly. And if you have any questions, feel free to pop them into the chat. That's the main reason why we're here, is to help answer your questions. So let's get started. We'll start with Kelly. If you can tell us a little bit about yourself and your role, and then Missy, if you can do the same.
Good day, everyone. Kelly Neville with the Student Wellness and Counseling Center, and I am the wellness lead here for the SWCC with involving university students and involved in the Healthy Campus 2020 movement as well. So I oversee the wellness navigators who are part of our counseling here at the SWCC and the wellness outreach and events that we host.
And Missy?
So my name is Missy Power. I am the, I guess, more of a clinical health lead here at the SWCC. So inside the Student Wellness and Counseling Center, we have a medical clinic, and I oversee the day-to-day functions of the clinic and the clinical services here on campus.
Is the physicians and nurses at the SWCC can provide?
So basically, we are like your regular family doctor's office and community health center, all in one. So we have a Cadillac service here for clinical services. So some of the services that the physicians would offer would be anything that you would get from your regular family doctor. So you know, if you have a respiratory illness, urinary tract infection, allergy shot, pap test, physicals, if you need your birth control renewed, or if you're looking to get an IUD put in, if you have sports medicine injuries, we insert IUDs, we do mole removals, toenails, get your warts burned off. And really interesting, we also have prenatal clinic and see families here as well, families of students. So we have a lot of children in our practice as well, which you know, it's a bit of a surprise for medical MUN students. And myself, I offer the services of a community health nurse or public health nurse. So your immunizations, some travel vaccines. So we have students traveling around a lot around the world, so we can help them with those immunizations. We do TB testing, and help our students out if they have if they had surgery, if they need dressings done, all those kind of all those services that you would get from a community health nurse, public health nurse, and a family doctor. So we're all in one, and all those services are here. It is.
And then what about for the counselors as the SWCC?
For the counseling and psychological services piece that we have here, providing supports and services, we work quite collaboratively with health, and it's been quite an interesting transition and augmentation with health moving up here with us on the 5th floor. But as part of our interprofessional team, we have, of course, as Missy said, the physicians and nursing, peer supporters. We have the counselors, which are our wellness navigators. We have our registered psychologists, who are also faculty here at Memorial University, and our case managers, who are the wellness navigators as well, and they provide counseling services. So we do have a consultation services available for our psychiatrist here at the SWCC. We have as well, I just briefly touched on our wellness and well-being events and outreach that we offer. And of course, it's been limited, but an interesting transition through the pandemic of how we do offer some of our wellness and mental health and well-being services and supports to students. And some of those that we're doing is involving groups, and that could be group therapy or something like mindful meditation. So some psychoeducational, and as well, some students have found it quite advantageous because they're being able to feel quite comfortable and be in their own surroundings and have a bit of privacy when they're doing the mindful meditation and things like that. So another thing is we work together with many different faculties and departments across campus, and with student life, we work quite closely with student support in regards to for counseling and seeing students. The access point for services for the SWCC is here at the SWCC, and we also have a number of psychology doctorate residents here at the Counseling Center as one of our training programs, but we also have our master's education counseling psychology students here from MUN, that also, and the grad students with social work. So, and we do have some other University of Lethbridge and Regina, a couple of universities in which we accept students here to do their practicum placements. Some of those are for a semester, but others are here for a year. So we've been able to embed students under supervision of all of us as clinicians, that they can be in different faculties and departments across the campus, which has been quite successful. So with our pandemic, we've had a few students working with us this semester, and when they came on board in April and May, they hit the ground running and helped with that transition, and it's worked out quite well, actually, and been quite successful. So we have our academic support piece as well, so helping some students with test anxiety and study skills. So that's quite a big piece of what we do as well. We can have, at the SWC, in total, we can have 30 to 40 individuals working in a semester. I know that sounds like a lot, but half of those can be our trainees that are here for the semester as well. So we're looking forward to the new semester starting in September, and we've done some of the group meets like this as well, and participated in provided some of our material and videos for the MUN 101 online. So the HKR co-op students have been contributing to that and done quite a wonderful job with that. So we have lots of things going on, and online resources as well, so that students can go to the mun.ca/student wellness/supports website, so that they can access those online supports and see what else it is that we do here at the SWCC.
And that link is in our chat right now if anybody needs to find it after the fact. You mentioned the term wellness navigator. I'm just wondering what exactly that means.
So that is, we have currently 4, with one coming back in the fall from maternity leave. They do a bit of counseling, and they also help students with navigating the systems at MUN, but as well in the community if they may need some assistance with maybe there's someone that is returning from a hospitalization from for a mental health or psychiatric issue, but as well we refer to the mental health Eastern Health's emergency room, but as well at the Waterford Hospital for the PAU. So we help and do a bit of community connections around that. so that and work quite well and a lot with graduate studies and with residents, because we want to ensure that all students are being supported as they need to be, so that no one falls through the gaps or the cracks.
Awesome. Where is the SWCC located? Either can take this.
I'll take it, I guess. We're located on the fifth floor of the University Center.
And are there any costs for the services that you both just described?
I'll go first, I guess, with that, because mine is much shorter than Missy's piece.
Yeah.
For counseling, it is included in students' fees that they pay at Memorial. But for us, the only thing right now that we do, there is a fee is for the assessments that are completed for ADHD, learning disabilities, and for assessments such as that. Your turn,
So on the medical side, your basic services provided by the physician or myself, there is no fee for those services. So they would be covered by your MCP card, your OHIP card, your MSI if you're from Nova Scotia. So your provincial healthcare card covers your visits to the physicians and the nurses, or the nurse. But if you're looking for any services that are required by a third party, so that would be like anything that you're asked for, like a medical for work, or a driver's license medical, or any of those services that are somebody else is asking you to do, well, those services are not covered by a provincial healthcare plan. So those services you would have to pay for. So sometimes if an employer wants you to get a medical done for work, you would have to pay for that medical. Those things are not covered. So those are the charges that you would pay to see if anything the doctor did for you. Those are the only charges you would pay. On the nursing side, there are some charges for some vaccines and the TB testing, because those once again are required usually for employers and jobs and school placements. So we bring in a lot of those vaccines at a very minimal charge, and sometimes they're free. They are given to us by Health Community Services, and we will administer those here. But some of the travel vaccines, of course, are more costly, but we do bring them in at a really reduced rate, almost direct for the students, so they don't have to pay as much for them. So there are a few costs, yeah.
And in terms of, and forgive my ignorance here, so if international students are coming in and don't have a Canadian MCP or version of MCP, how does that translate?
So every student here on campus should have insurance. It's one of our requirements for Memorial. So if they don't have MCP or like a provincial healthcare card, they will have international students insurance, and that will usually cover their visits. Sometimes it's a bit more tricky if there's pre-existing conditions, but for the most part, if the students need to see a doctor, it is covered by the international student insurance.
Okay. Again, it's not. I'm not well versed in it, but the idea was in my mind. So, if somebody is looking to get connected with a counselor, physician, or nurse remotely, how would they go about that?
So I have said through this whole COVID stuff, we are open. We haven't closed. So if you want to reach the center, you can call our main number, 864-8500. If you hit option 4, you will get connected to the front desk, and our administrative staff are here working on campus, and they will answer your call. So that's how to get a hold of physician or nursing. And then, Kelly, you're going to have to give the email. So if you're trying to get in touch with a counselor or wellness navigator or the wellness side, Kelly will give you the email.
For the counseling and psychological services and the wellness navigators, and for wellness events and outreach, It's the swccwellness@mon.ca email, and all of those requests can come through there. Right now, most of our clinicians, the wellness navigators and the psychologists, are practicing virtually, off-site, remotely. So I am in a lot of the time. One of the registered psychologists is, but for the most part, they are all practicing virtually, and it hasn't impeded any of our services and supports that we offer. So we have actually the numbers are up that students, through, of course, we understand through the pandemic and through this spring, summer, and into the fall now, are that the numbers are up and we are getting more requests than we had in previous years. And that's understandable.
Right.
If I could just add one quick thing, our physicians are actually doing a mixture of in-person and virtual appointments. So for the most part, the appointments are virtual, but of course, like everything, we can't listen to a fetal heartbeat through the phone. So, if your doctor needs to see you in person, you will be told that your appointment is in person, and we are still seeing people in clinic. And as well, our PEP, we're starting to fall behind in our PEP testing and STI screening. So we have added special clinics on for those. So you'll see those posted on Facebook and Twitter when we're having those, so people can come in person and get those done. So we don't fall behind in our routine screening for diseases.
And are those walk-in or appointment-based?
Those are appointment. So we'll advertise those, and our electronic medical record here can also send out notices. So anybody who's registered in our system will also get an email letting them know that those services or those clinics are ongoing.
Okay, great. So that sort of answers my next question. If I'm in St. John's, am I able to go in person? But from what you're both saying, it's best to call and make the appointment instead of just showing up, hey?
Yeah, an email. Yeah. It's best for both counseling and for health appointments. It's best to email, actually, because they're continuously monitored throughout the day for when we are open from 8:30 to 4:30 right now. They will get answered, and we find sometimes, Missy, you can speak maybe more to the telephone and the Health Myself application.
Yeah, so once again, I mentioned our electronic medical record, our electronic health record that sends out notices. Well, this system also lets students go in and book their own appointments. So there should be a link on our website that allows students to create their own appointment, and you can go in and book your appointment yourself with a physician or myself.
Great. You already sort of touched on a little bit of the groups that are happening at the SWCC in your introduction, Kelly. But I'm wondering if you can expand a little bit on what kinds of groups that I could attend at the counseling center.
So our groups are offered virtually. We did have this summer the mindfulness meditation. We offered a number of academic supports, time management, procrastination. So those were more studied remotely. And we had the one that we had offered on Mondays and that covered a lot around COVID-19 and anxiety and moving forward in the fall and things like that, and taking care of yourself throughout this time. So that was managing Madness Mondays. So we will continue with some of those same series of videos throughout the fall because of our HKR co-op student that we'll have with us. But the videos that have been already completed and recorded will be going up on our website in the future. Rebecca, I think you're muted.
I am sorry. I was trying to cut down on the echo. Thank you. It was mentioned that a student's spouse or children can see a doctor or nurse, but can they also access the mental health counseling?
Unfortunately, for the counseling and psychological um, registered psychologist appointment, they're for students that are currently registered in the current semester online, excluding family members, unfortunately.
And the wellness navigators are also capable of providing study tips.
Yes. Yeah.
Perfect. And if somebody is feeling stressed or anxious, what online and community supports are available to them?
For that piece, we have our WellTrack program that's offered online. If you go to, I'm just gonna, you will see our wellness ones, the same, the student wellness slash supports dash services slash wellness. You will see the list of choices there for healthy and to live a fulfilling life that are available to students. For the community resources, when we are not, and just want to touch just a tiny, tiny bit on, we're not crisis management. If someone is in crisis, we encourage them to go to the Health Sciences Center emergency room or the psychiatric assessment unit at the TAU, that's at the Waterford Hospital. But as well, there's available is the crisis mobility unit with Eastern Health. And the resources, again, can be found on that same website, but it includes, like, it's the online resources as well. So folks can also avail of Channel in the community. It's a warm line of peer support that students can avail of, but as well as family members. After hours, there's also the 686868 text to chat with the Kids Helpline, and that does not, they do include university students in that, and they do have a fair amount of support given to university students with that program. There's also Bridge the Gap, which is a provincial-wide community resource that's offered online. They have different chat rooms and support programs within that, and one of those is called Therapy Assisted Online that any person in this province can avail of. So, and it's quite helpful to folks.
And if anybody is trying to find it that's watching this, Channel is CHANNAL, correct?
Yes, in
And
capital.
then Bridge the Gap is gap with two P's.
Yes.
Just to make it easier for everybody's Googling after the fact. So if somebody has questions about the student insurance plan, where should they go?
So it depends on which plan. So we actually have several plans here on campus. So if they're an undergrad student, they should go to Munsu because Munsu administers that plan and they can help with their questions. If they're a grad student, they can go to the GSU and they will help them with their insurance. And if they're an international student, I would advise them to go to the international office. They would have all the particulars about their plans. Yeah, so it depends on what kind of student you are.
Right. And our students access the doctor and nurse and mental health appointments in the spring and summer term if they only take classes in the fall and winter terms.
So for the medical services, they can. So we have a unique population here at MUN. So we generally get our students for 4 or 5 years. And then after you graduate, we would like for you to transition out to the community. You're ready to go on your own and get your own family doctor. So that allows us to, kind of transition those students out and make room for the new students and their kids coming into the clinic. So we will see, basically we try, if you graduate in or convocate in April, we give you the summer, we clue up all your, any ongoing issues that are ongoing, and give you time to find another family doctor before we ask you to kind of move on. But if you're not graduating, of course, we see you the whole time. It doesn't matter if it's spring or summer.
Okay, great. So I'm just kind of gonna start to clue up. I'm wondering if there's anything that we haven't touched on that either of you would like to share.
I just want to follow up with that question for the counseling and the psychological services piece around in between semesters, because there is a time frame when students are registered to come in to start in the fall, and so we will start seeing those students, the new ones, who come starting after the first day class is starting. But we do have a time frame when students are, say, registered for the spring, summer, and are registered for the fall as well to come back. But we do offer, some same day, I want to say, single session kind of in between those times for students. But there's also doorways in the community that's offered through Eastern Health that anyone in the province could walk in and have services available to them on the same day. So there is on Eastern Health's Mental Health and Addictions website that can be found.
Rebecca, I'd just like to really mention really quickly is our new Ask the Nurse feature on our website. So Ask a Nurse is a place where students can go in and submit a health-related question. It just keeps us in contact with the students, especially while we're away and everybody's studying remotely. So you can go in on our website. There's a link. It's Ask the Nurse or Ask a Nurse, and it's ask me. I answer those questions. So if you have any health concerns, is this some of the questions I've got, like, is this normal? Do I need to see a doctor? How can I get rid of the pain in my knee? That sort of thing. So if anything that we can help students with, they can certainly use the Ask a Nurse feature on our website.
Great. Anything else that incoming students should know?
Just we're here for them. We're here. It doesn't, they may be remote, but we're here all over, anywhere they're studying in the province of Newfoundland, Labrador. We're their doctor. We're here for them or your counselor, and we're available and we're open.
For counseling and psychological services, for the new students coming in, it is quite, we are available across Canada if they're located within Canada, but it is a transition for them, and it's different. And even if students coming from around the Bay into St. John's that are going to be here in the city, it's a transition for folks, and as well remote, and some may find it easier, but it is different. And culturally, we have to remember that these students need support.
I think that's worth reiterating about most of the staff on campus for any incoming students, that the staff want to see you succeed, whether it's your professors or services like you guys provide. There's definitely supports there for you. Thank you both so much for your time today, and thanks everybody for joining us. The next Ask Me Live studio is happening next Friday, August 28th at 2 p.m. and it'll be a Q&A with the Math and Writing Help Center. Perfect.
Thanks, you.
Guys.
Thank you.
Take care.